I'm Dr. Dan Stock of PureHealth Functional Family Medicine, and here we're to discuss the problems with the present healthcare system. So I think what people need to know about the healthcare system is the consumer right now is no longer the guy paying the bill and has no ability to make the definition of good healthcare. Because they're buying all of their goods and services through a third party, and especially buying the advice about those services through a third party, the definition of good healthcare is whatever the third party thinks is a definition of good healthcare, and they usually have very different motivations than the patient does. When the Affordable Care Act was passed in 2008, one of the codicils of that law was that insurance companies had to spend 80% of the premiums they took in on healthcare expenses. This meant that they could only give 20% to their employees and their stockholders, but it also cemented in law that the only way they could increase profits was if people bought more health care. Therefore, their incentive to maximize profit was only pulled off if they could get people to buy large amounts of healthcare services at the budgeted rate. They also changed protocols to make it so that paid doctors to actually spend lots of money and punish doctors if they didn't. So the doctor has a built-in reason that in every gray area decision, the decision will err on the side of spending money, but only if it's spending money at the budgeted rate. So if your doctor looks at his computer and enters in the computer chart that you have hypertension, then there are certain medicines that he must prescribe a certain percentage of the time, and if he's below a certain percent, his pay starts getting cut. If he starts making little enough money for his hospital will fire him. One of the things that makes this prepayment scheme work is that the definition of care isn't in their control. So one of the things that came up is the requirement by the Affordable Care Act that preventive care be paid for. But it was left up to the Center for Medicare and Medicaid Policy and the Department of Health and Human Services to determine what necessary or preventative was. A good example of this is your screening colonoscopy. So your screening colonoscopy is preventative for colon cancer, so it's covered. Unless in the middle of the colonoscopy they find a polyp. If they find a polyp, then suddenly in the middle of that procedure it stopped being a preventative screening, became a treatment procedure, and you wake up with a $2,500 bill. I think the only solution that's going to save this healthcare system is if we have patients take back the ability to spend their money directly. We need to do away with third-party payment, especially for the purchase of advice. As soon as you start purchasing advice from somebody who is being paid by a third party, he's going to change his advice to do what the third party will pay him most for. Therefore, what I would encourage any patient to do is to pay for your advice directly and investigate whether or not the doctor you're buying advice from has any financial conflicts of interest. I'm Dr. Daniel Stock. If you have any questions about the healthcare marketing system running in the United States nowadays, please feel free to reach out to me at PureHealth Functional Family Medicine.